It is my pleasure to welcome you to the Global Leadership Lecture organized by the Communication Area at FORE School of Management. The Global Leadership Lecture Series is an initiative by FORE School of Management where we invite globally acclaimed speakers to discuss topics of national and global importance. From the communication area, we envisage this initiative as a dialogue critical for nurturing our students as global citizens and strategic communicators. In the current times when the world is facing so many challenges, it is ever more important to forge a strong network of scholars and practitioners. I would like to introduce FORE School briefly. FORE stands for Foundation for Organizational Research and Education. It is commitment to the advancement of management education, research, training, and consultancy. It was incorporated in 1991 as a non-profit institution, and it has worked ceaselessly with industry and academia for developing new domains of managerial thought, knowledge, and education, and has contributed to building leaders into today's global business environment. We have about 200 or more CEOs distributed across 6 continents of the globe. And we are very proud of how our students have lived up to the kind of commitment that FORE has always emphasized. Dr. Shetty needs no introduction, but I'm not going to let go of this very rare honor and privilege to welcome him as our speaker this evening. Dr. Shetty is the chairman of Narayana Health. He founded Narayana in 2000. And since then, it has grown to be one of India's largest healthcare groups providing world-class, affordable, safe and quality healthcare for all. Over the course of his distinguished career, Dr. Shetty and his team have performed over 120,000 heart surgeries, 40% of them on children. A strong advocate for the application of technology in healthcare delivery, Dr. Shetty is involved in projects that can reduce time, cost, improve clinical efficacy in healthcare delivery. He is the recipient of numerous awards and honors, Padma Shri and Padma Bhushan, awards conferred by the Government of India, and Rajyotsava Award conferred by the Government of Karnataka. Dr. Shetty, I have no words to express our gratitude and warm welcome to you. Just before I was about to switch on, I received a call from Narayana that he has taken a break from a board meeting to come and speak to us, and then he has to go back to the board meeting. That's incredibly kind of you, Dr. Shetty. Thank you. And welcome once again. It's over to you. So we are all agog to listen to you. We have 219 people who have joined, and more, I am sure, will be joining. Dr. Shetty, over to you.
Thanks. I would like to talk to you the power of thinking different. First, let me say why I thought it's important to all of us to think different. I am a heart surgeon by profession, but my job is very interesting. My job is putting price tag on human life. Now, I'm sure you're intrigued. How do you put price on human life? How do you put a price tag on human life? Every day sitting in this chair, I see about 50 to 100 patients. Good number of them are children, little babies on the mother's lap. I examine the kid and I tell the mother that your baby has a hole in the heart and she requires an open heart surgery. She has only one question. I'm not sure whether you're able to guess what that question is. It's not about the scar or the risk of operation or the future of the baby. It's all about how much it is going to cost. If I tell her that it's going to cost 80,000 rupees or 1 lakh rupees, which she doesn't have most of the time, that is the price tag on the child's life. You come up with 1 lakh rupees, you can save your child. If you do not have 1 lakh rupees, you're going to lose the child. This is what I do from morning till evening. This is what most of the doctors in all the developing countries do from morning till evening, putting price tag on human life. We call ourselves as a civil society, most advanced civil society. If society has given the power in the hands of few people officially to put the price tag on human life, we have collectively failed as a society. This cannot go on. We can keep on criticizing, but something has to be done. Now, whatever you want to do, it has to address multitude of complexities of the need of these 1.3 billion people. So you have to address just not the healthcare of the few people who need it. You need to address the entire ecosystem of a nation called India. Now, we thought only way it can be done is by thinking different. Now, I'll talk about few things we have done in our journey in the last 30 years now. And these are few instances with some examples of how thinking different can make a massive difference. I'll show my slides. Can you show the slides? Global healthcare and wellness industry. I just want all your young students who are looking at career. When you're looking at a career, you should always look at a career in an industry which is the largest industry in the world. Because when you become part of a large industry, your opportunities of climbing up the ladder is very, very high. So the whole advantage of joining healthcare industry is that you are going to join the largest industry in the world. Next slide, please. I'll just show you the data. Many of you may not be aware that healthcare industry is a $8.2 trillion industry. It's the largest industry in the world. Even food industry is less than that. And everyone thinks IT is big. IT is only $3.4 trillion. Oil is only 2 trillion. Automobile is only 2. They are nothing compared to healthcare industry. But next slide, please. The advantage we have as a country is that today IT is one of the industries which gives us about $140 billion of annual remittances. That many people, that much of money comes to India. Today, India has an opportunity to earn over $100 billion of remittances just by investing on education of doctors, nurses, and medical technicians coming from lower socioeconomic strata. Because across the world today, there are more than 80 million worker shortage. And India can produce most of these workers. I'll give an example. Cuba earns $8 billion just by sending 45,000 doctors, nurses to Central America and Africa. Philippines earns $29.7 billion every year. Majority of them come from 150,000 nurses 18,000 physicians working abroad. All we have to do is to train 5 million doctors, nurses, and technicians. They can easily remit $100 billion every year. Now, what is the difference of $150 billion coming from software company and $100 billion coming from remittances from doctors, nurses, technicians, mainly nurses? The difference is when the software companies get $150 billion, that money goes predominantly to the shareholders of these big companies. Whereas when 5 million nurses, doctors get the money, most of the money goes to 5 million households. Next line, please. Mainly the poor households. And healthcare industry can be the largest employer for women. Now, why do we need to look at employing largest number of women from lower socioeconomic strata? When we started our journey, when we had about 5,000 employees, about 90,000 employees of ours were women. Now we have close to 15,000, 20,000 employees. It's come down. Our ambulance drivers are women. Our security guards are women. Most of the people working in the hospital are women. Now, why is it important? In Calcutta, when I used to work, I observed something very interesting. If you have the job of cleaning the floor, if you give the job to the man and give him 12,000 rupees per month salary, he will spend 6,000 rupees on himself, and 6,000 rupees goes to the family's welfare. If you give the job to his wife and give her 12,000 rupees salary, she will spend the entire 12,000 rupees on the family's welfare. And a woman who comes from a lower socioeconomic strata, when she becomes an employed woman, she becomes an empowered woman. And an empowered woman will become assertive. She will teach the art of making choices to her children. If you notice, a lot of poor people, they one after another, why they remain poor eternally? They remain poor because they keep on making wrong choices after wrong choices. Because when they were children, they were not taught the art of making choices. When parents, when mother brings up the children, constantly it is saying, no, you can't do this, you can't do that. You have to be home at 5 o'clock. You have to eat at 1 o'clock. Now, it may look like a mundane instruction, but this is how subconsciously you are disciplining the children to focus. And these children, when they grow up, they will build a great nation. So if you want a great India to be a great nation, we have to create employment opportunity for children, the women from lower socioeconomic strata. Next slide, please. See, this is a slide of a young nurse. She joined our hospital as a ANM. Then in our hospital, she joined our nursing college, and subsequently she became a GNM, then a BSc. When we started our hospital in Cayman Island, she went there because she is one of the outstanding nurses. And she took her entire family on a holiday to Niagara Falls. You look at the contrast of where they come from, one of the hamlets in Tamil Nadu, to flying to Niagara Falls for a holiday with the family members. We have right now 110 nurses. We have many other employees, 110 nurses. They are hardly 23, 24. They come from very poor families. They became nurses because of our nursing college. And they individually they earn more than 1.7 lakh rupees per month. They send every month at least 1 lakh rupees back home. You can imagine the impact that 1 lakh rupees has on those 110 families. It will dramatically take them to the next level. We produce 24 million babies a year. We simply do not have the resources in our country to feed them and give them the exciting job opportunities. We have to look at the world as a marketplace. We have to change our way of education so that they will be gainfully employed in different parts of the world. And these nurses are so good. Earlier, the nurses from Cayman Island needed to pass the entrance exam and all kinds of hurdles to go to England as a nurse. Today, they work in our hospital in Cayman Island for just 1 year. Next year, they are off to England working for NHS, National Health Service of England. The career changes, and all they had was a BSc degree from a nursing college. So this is the power of thinking different. Next slide, please. Now, I'll give you the why our healthcare health sector in India, especially the public sector hospitals, are not living up to the mark. Because I have gone through our Indian national policies on healthcare. I have scanned the documents of virtually every developing country. Every developing country's healthcare strategy, the public healthcare strategy, is revolving around malaria, TB, and HIV. And malaria, TB, and HIV collectively kills about 3.5 million people a year across the world. But lack of access to safe surgery kills 17 million people. And when I talk about the surgery, I'm not talking about heart operation or a brain operation. I'm talking about bellwether surgeries, 3 commonly done procedures. That is laparotomy for a burst appendix, surgery for compound fracture, that is open fracture, and emergency cesarean section for obstructed delivery. If we can create hospitals across the country to do these 3 procedures, that's all, which doesn't look like a rocket science. All the malaria, TB, and HIVs can be managed virtually free in this setup. But if you put all the national attention and the sources, financial sources, on malaria, TB, and HIV, surgery will remain as a neglected orphan child. And today, surgery is the neglected orphan child of public health. So if we change our strategy that surgery is very important, then all the other aspects can be done virtually free. It is a change. It's a matter of asking the right question. What do you want to, what is the priority? Next slide, please. Now, let's come to the farmers. I want to ask all the youngsters, you read in the newspaper, you see the farmer's photograph in any magazine or any newspaper. Why is the farmer constantly looking up? It is always, the moment you talk about the farmer, the photograph shows, irrespective of which part of the country, they're all looking up, because 73 years after independence, our farming, agriculture product depends entirely on rain. We haven't been able to provide some other source of water for their whatever they want to do to grow their crops. Are we off? I think they've gone off, I think.
If we can hear you.
Can you hear me?
We can hear you absolutely fine.
Okay. Yeah. Now, a farmer, his only revenue is selling what he grows. That is whatever crop he gets. Now look at three scenarios. If there is no rain, there is no crop, there is no money. Let's look at another scenario. If there is a lot of rain, heavy rain, again there is no crop, there is no money. Let's look at the best scenario. There is adequate rain. Then what happens? He gets bumper crop. And whatever he has grown has no value. So whatever way you look at, it is a matter of a time farmer will go bankrupt. Now, one of his main, we have no answer for his problems. But if he falls sick, we can offer him health care. Next slide, please. Next slide. Around 15 years ago, the consecutive 3 years, Karnataka had drought. So at that time, we convinced our government to launch a health insurance for the farmers. Now, when we talk about the insurance, we always think about premium of 20,000, 30,000 or 1 lakh rupees. Our strategy was to sell them a health insurance with a premium of 5 rupees per month. 5 rupees is approximately the amount of money they spend on tobacco every day. So we thought if we can ask him not to smoke one day, instead buy the health insurance. And the next condition is that government should become a reinsurer. And this insurance called Yashaswini was launched in Karnataka 15 years ago with a premium of 11 cents, that is 5 rupees per month. And we had over 4.5 million farmers paying the money, and government agreed to become a reinsurer. In case we went broke, they would bail us out. And it was launched to the Karnataka State Cooperative Society. It is their program, we guided them. And we network with 400 hospitals across the state. And there are about 650 to 1,000 types of operation. This insurance is only for surgeries. If they require any operation, including heart, brain, cancer surgery, everything is covered. And at the end of 15 years, 1.2 million surgeries were done on these farmers, and 1.3 lakh heart surgeries were done just by paying 5 rupees per month. Now, poor people in isolation are very weak, but together they are very strong. Now, cooperative society brings all these poor people together, then you deal with them. Imagine a situation, we have close to 950 million mobile phone subscribers. They spend 300 to 500 rupees just to speak on the mobile phone or entertain themselves. If we can collect 30 rupees from each mobile phone subscriber and offer a health insurance to cover for all types of surgeries, entire health sector of the country will undergo dramatic change, because then the government hospital will also start getting revenue. So essentially, if you think different, many of the complex problems can be solved. There is nothing like one big problem. There are thousands of small problems. So you take out one small problem and keep addressing it. In the end, you solve the big problem. Next slide, please. So all these things, we always think that to bring about this transformation, you need people like Bill Gates with billions of dollars, or you need United Nations or a WHO. I can tell you that most of the path-breaking events in the world, if you read it, understand, never doubt that a small group of committed people can change the world. Indeed, history shows it's the only thing that has. So never look at yourself as I am only a small person. How can I change this? Everything depends on the purpose on which you believe in, you want to fight for. It's the power of purpose. You look at Mahatma Gandhi. I guess he's 5 foot nothing. He's not the strongest man. He doesn't come from the richest family. He is not the greatest orator. He mobilized 450 to 500 million uneducated people to fight for the freedom. Freedom, the meaning of freedom, our people didn't know because they were slaves, their parents were slaves, their grandparents were slaves, and they were comfortable with what they had. Selling them an idea that freedom is more important than life and convincing them to be prepared to even sacrifice their life for the sake of freedom. At a time, forget about internet and the cloud solution, there are the social networks, there was not even a paper. How could he do it? He did it because of the power of purpose. So if you have a very strong purpose, which is going to touch the lives of millions of people, cosmic forces connive their way for it to happen. Magical things will happen. So this is why I keep talking to people about youngsters, especially because the future belongs to when we grow very old. When I reach, if I am alive still, when I am 95-year-old man, if I am alive, when I read the newspaper, I would like to try and create the content of the newspaper now through all of you. Next slide, please. Now, all this transformation to happen, you need to change the way hospitals are built. There are nearly 100 towns in India with a population of 500,000 to 1 million, where they don't have a super specialty hospital for heart surgery, cancer surgery, because they can't afford these big posh hospitals. They cost millions of dollars. So we wanted to build a model hospital which will be up to 300 beds. It can do heart surgery, cancer surgery, and everything. And it should cost only $6 million. $6 million will be about 35 crore. Instead of 200 crore rupees, 300 crore rupees. And normally it takes 3 years to build a hospital. We wanted to build it in 6 months. So we approached L&T, which is India's largest construction company. We told them we have $6 million and we will give you 6 months to build the hospital. The first time they thought that we are gone crazy, but then they took the challenge. Next slide, please. Next slide. And they built the hospital. Now, how this is built in Mysore. How this hospital is different. This hospital is in Mysore where there is pleasant weather around the clock. So there is no air conditioning system, central air conditioning system. Now, everyone thinks that central air conditioning system in a hospital is required to control the infection. But very few people know that the commonest source of infection in a hospital is a central air conditioning system. The best sanitizer for a hospital is the fresh air and sunlight, which we do not allow to enter through the central air conditioning system. So essentially, we changed a lot of the assumptions of how a hospital should be. And it's a very successful hospital of ours. Next slide, please. So how do we train nurses and doctors? I just want to tell you, you would have gone to few ICUs in your life to see your, somebody known or somebody, or in the movies you would have seen ICU with cardiac monitor, all the nurses looking at the cardiac monitor. If you ask those nurses, what do you see in the nurse? 95% of them have no idea what the ECG is like. I can tell you that huge number of doctors also can't interpret the ECG to tell you what it is, because it is extremely complicated to learn. Why it is extremely complicated to learn? Traditionally, these are taught teaching the fundamentals of what that P wave is, QRS is, why the wave is like this, when the wave changes, what happens in the heart. This is the way it is taught. Now, there is a program, there is a site in internet called SkillStat that gives about 30 ECGs. We called 100 nurses in our ICU who worked in the ICU for 6 months. We told them that this is the SkillStat. Now you diagnose it. The moment you touch the button, one ECG will come that will give you 1 minute to answer. You have to get the right answer, what the diagnosis is. Like this, you do it for all the 20 or 30 ECGs. That will tell you how good you are in diagnosing the ECG, making the diagnosis using the ECG. And 100 nurses, all 100 of them, got everything wrong. Not even a single girl could recognize what that rhythm meant. Then we told these girls, you have 1 week. This is SkillStat. You spend time, keep looking at the wave and understand the diagnosis. We don't want you to explain to us the rationality of why it happened. We just want to we want you to tell us what the diagnosis is. That's all. So that you can call the doctor and say, this is the diagnosis. And we gave them 1 week. And we didn't teach them anything. We just told them this is the site. 1 week later, we held the test again. All 100 of them got everything right, 100% right. And we never taught them. No cardiologist ever spoke to them. This is the power of pattern recognition. She's a nurse. She doesn't need to know why this is happening. Her job is to look at the monitor and tell the concerned people this is what is happening. This is the difference between skill and the knowledge. If you want to train a bus driver, if you go to a university, ask them to create a curriculum to train the bus driver. They will make a curriculum explaining the aerodynamics, engine, ignition system, how the system of the whole automobile works, but they will never put him on the driver's seat and teach him how to drive the bus safely. Instead, if you send this person to a driving school, from day one, they will put him on the driver's seat and teach him how to drive the bus safely. And this is how our education should be. We should train nurses to do what she's supposed to do. Not teach her what a DM in cardiology should know. For everything, there are different sets of people. So we need to redefine what skill education is. Next slide, please. Next slide. Next slide. Change. Next one. Just want to give an example of how to control the cost. Around 12 years ago, you would have seen most of the Indian hospitals, when the surgery happens, you see the cotton, linen gowns worn by the doctors, and that is the way they wear themselves and cover themselves and do the operation. Linen is porous. When we finish the surgery, half the blood goes to our t-shirt and it's on our body. And during rainy season, you cannot dry these linen. So 12 years ago, we wanted to go for a disposable gown. We talked to many hospitals, many companies. There are only 2 companies in India from US. They were selling the gowns. They wanted us to give them 5,000 rupees for each heart operation. And our budget was 1,000 rupees per operation. And we couldn't convince those companies, and we were giving large volume. About 14% of the heart surgery done in India is done by us. And we offered them the volume that you get 14% of the volume of heart surgeries. You give us this price. They refused to come down. Then we got hold of young people's entrepreneurs in Bangalore. We told them that the material for the gowns are made by a company called Alstom, and we will give you 14% of the market share to start off. But you have to sell it to us at less than 1,000 rupees. And we taught them how to do those things, and they started a company called Emerallis. And they started selling it to us for 750 rupees. And today, Emerallis, you would have seen during the COVID time, most of the gowns worn by people were made by them. They are the #1 surgical disposable company in India. All because there was a need and there was a buyer, and the buyer and the creator work together, and this is what happens. So during the COVID wave, we need not depend on importing these gowns and drapes. It was already available in India. Next slide, please. Yeah, just what, and I keep talking about thinking different, how some little things can change. Traditionally, when a heart surgery or any operation is done, the spouse stays with the patient. Wife has operation, husband stays, husband has the operation, wife stays. But in the hospital, they are never made as a part of the caregiving team. So a man gets the operation done, he goes back to the ward, wife stays with him. She is never taught what medicine he is on. She is never taught how to do the wound dressing. He is never taught importance of maintaining how much urine he is passing, or a physiotherapy, or how to check the blood pressure. We never teach them. But when they go home, we call the wife, we give her a plastic bag with all the medicines, and we tell her, now you take care of your husband. Irrespective of how smart she is, she's lost. She doesn't know what to do with him. So we thought, let's involve the spouse in the patient care. First, we taught them how to check the blood pressure, how to check the pulse rate, what is the significance of pulse, how to check the temperature, how to check the respiratory rate, and what is the importance of giving medicines on time, how to give physiotherapy to a heart patient. We taught all these things those 5 days when the patient was there. And when the patient went home, we normally call them to find out how they are. And it was like when we talk to the spouse, it is like talking to a medical person. She will start saying that his input was 2,000 liters, his output was 1,200 liters, whatever the medical terms, and he's doing well, he's ambulating, and most of the medical terms and interestingly, some of these women, when they went home, when they were checking the blood pressure of the spouse, the neighbors looked at it and they got excited, and this lady can check the blood. They also wanted their blood pressure to be checked. And so many people had a high pressure, but they didn't know it was all diagnosed because of somebody had the blood pressure apparatus costing 2,000 rupees, and she knew how to check the blood pressure. And interestingly, around 8 years ago, British Parliamentary Commission recognized this program called Care Companion as one of the best patient empowerment tool in Britain. So this is the recognition we got from the British Parliamentary Commission. All this happened because we just wanted someone to take care of the patient at home, and it costed us nothing. Next slide, please. Now, we always have a mental block of doing a particular job. They have to have a BSc, MSc, or whatever the high college degree, whatever. And without that, they can't do it. Now, our hospital where I work is Joint Commission accredited hospital. And we do huge number of heart surgeries. And these girls who work as our nurses, in 2 years, they can walk into any hospital in the Middle East and get higher salary than my salary because they are in such a great demand. Now, in heart hospital, it is very important that when we do complex operation, you can't keep on telling the nurse what she should give. Why I am showing this photograph? This is a beautiful photograph. And it is in my office. You can see it there. It's in my office. You can see just behind me. It's a beautiful photograph. And anyone walking to my office, they'll ask me who the painter is. And I want to ask you, who do you think is a painter? I get names like Michelangelo, M.F. Hussein, and all these characters. This is painted by a trained elephant in Thailand. They train elephants to do this beautiful painting, and we admire the painting. If elephants can be taught how to do the beautiful painting, can't we train smart girls from the villages how to hand over an instrument when a surgery is done? It is possible. So we have a nursing school. We have many nursing schools. Some girls can't afford to join the nursing college. So we teach them a training program called nurse assistants or CCAs, critical care assistants. And they work they're trained only to assist for heart operation. They cannot assist for a neurosurgery procedure or appendixectomy. They don't know. But heart operation, they know everything. They are so smart. When I put my hand during the operation, I'm looking inside the little baby's heart. I put my hand and I tell, sis, give me 6-O-Prolin. That is, Prolin is the suture we use for heart operation. I'll put my hand and I'll ask her to give me 6-O-Prolin. She will give me 7-O-Prolin because she knows the step of the operation I am in, I need 7-O-Prolin, not 6-O-Prolin. She knows. She gives me what I need rather than what I asked for. And she may be just a 10th standard student. That's all. And she spent 3 years, 5 years. And what makes the difference is that she's very, very, very passionate about what she's doing. And that makes the difference. And this is what we need to do if you want to change the world. Next slide, please. Next slide. Now, some of your young kids may be thinking, this man is talking about so many things. Has he really done something worthwhile? I just want to show you. This is for these youngsters, this is the cover page of Wall Street Journal. And we were on the cover page of Wall Street Journal, I think about 10 years ago. Next slide, please. About what we do. And if you ever join Harvard Business School for MBA, the first lesson you will be taught is the philosophy and the business model of Narayana Heart Hospital, Cardiac Care for the Poor. It's been taught in Harvard Business School for the last, I think, over 15 years now. Yeah. Next slide, please. So I just want to end my talk giving you a very simple message. that the world is not ruined by the activities of bad people. We always think that bad people are always up to mischief and they are the ones who are ruining the world. They are not the one who is ruining the world. The world is ruined by the inactivity of the good people. So if you want to see a better world, good people should come forward and make it happen. Next slide, please. Next slide. The moral of the story in the end is that you're all in business school. You can close it, yeah. You're on business school. One day you will come out of the school and you will do, some of you have it, your friends, 3 or 4 of you get together and you all start discussing, let's do something different. Let's do something big. You all want to do something. Now, the discussion among you with your friends, most young people, when they get together, when they want to do something big, the discussion is about, first question is, what to do? What shall we do? Shall we start a startup on healthcare, or shall we start a startup on agriculture, or whatever? The next question will be, how do we do it? Where to raise money, where the office should be, how many people, right? But next time when you get together with your friends, try to discuss about a business proposal. First question you ask is, why should we do it? What is the purpose of doing it? If the purpose of whatever you are doing is going to make this world a better place to live, if it is going to touch the lives of millions and millions of people, believe me, cosmic forces will make sure you succeed. This is the power of thinking different. Thank you so much for the opportunity. Thank you.
Thank you so much, Dr. Shetty. I think our participants will yes, a huge round of applause. It's absolutely stunning as always. So I'm going to request the audience to please put your questions in the chat box. We are taking questions. We have 321 people who have joined, and I can see a lot of enthusiastic response. It would be good to have some questions now. If you have any questions, please put them in the chat. Oh, we are getting a lot of questions right now, so I will read them out to you.
Sure.
Yeah, this is from Tamish Gupta. What are the major shortcomings or the hard steps currently in the Indian healthcare system?
Our major problem is shortage of doctors, nurses, and medical technicians. Now, why we have a shortage? Predominantly because medical education is made very, very expensive. It costs about 500 crore rupees to set up a medical college. And this is in India. You can go to Caribbean and buy a medical college which trains doctors for US for 15 crore rupees. And that's all it costs. So we have made medical education as an elitist affair. And we are going to pay a huge price if we don't change, because outstanding doctors with magic in their fingers generally come from deprived background, because these are the kids who have the fire in the belly, willing to work for 24 hours to become outstanding doctors. Now, those children have stopped dreaming of becoming doctors. And if that happens, if it continues like this, we are going to pay a heavy price. I wish our strategy of medical education changes.
Very crucial point, and we often don't think about it, the elitist approach at least. I think that is a fabulous comment from Dr. Shetty. We have the second question from Nikhil Raj. We have seen India as a major medical tourism hub, yet many shortcomings in the sector. So how does it fare in comparison to other Asia Pacific countries?
See, among all the countries in the world, India offers the most affordable healthcare at an unbelievable price. I will give you one example. I left England in 1989, and the first patient I did the surgery in Calcutta paid about 1.5 lakh rupees for a bypass grafting. That is 30 years ago, 32 years ago. Today, I do the same operation for less than 1 lakh rupees. 30 years later. Tell me what was costing 1.5 lakh 30 years ago is costing 1 lakh rupees now. So this is the magic what passionate doctors in India have been able to accomplish. Now, India is blessed in having outstanding doctors, fantastic nurses, excellent technicians. It's like God has designed us as healers. And we are in great demand all over the world. If you go to US, you'll be surprised. There was a study by Harvard Business School which showed that Americans who are treated by Indian doctors, immigrant doctors, mainly Indian doctors, lived longer than the Americans who are treated by American doctors. So this is the power we have, and India is a fantastic tourist destination, medical tourist destination. It will continue to flourish. Yeah.
I think that's a very telling comment. I think we have a lot of empathy and we don't realize how this can be our greatest soft power in more ways than one. And actually, it reflects in the caring we provide. We have another question from Biprajit Biswas. The word affordable has always been attached to your healthcare services. So why aren't the same methods used pan-India to reduce the cost of healthcare?
See, today healthcare has reached the stage wherein any more reduction in cost of delivery will only compromise on the quality. Time has come for us to look at financial intermediary called health insurance to make a difference. It's fascinating for me to see young startups coming up who are offering health insurance up to 1 lakh rupees with a premium of 999 rupees. I strongly feel government should encourage more and more of the startups to come up and offer affordable healthcare. Going forward, expecting people to spend their life's earning for a healthcare intervention is unacceptable in any civilized society. There has to be a method for them to contribute a tiny amount of money every month or every year, which will take care of the healthcare needs whenever they want. I can tell you that in the US, if there was no health insurance, most of the even political leaders, even presidents may not be able to afford the cost of healthcare. So we need to create the financial intermediary. Government should encourage as many people as possible to get into health insurance, and the premium for health insurance should be made tax exempted. Then there is an incentive for people to buy the health insurance, and as more and more people have the health insurance, they will become assertive. Today, people come and touch our feet to save the lives of someone they love. We are not elated. We feel humiliated because we are the so-called educated, knowledgeable people. And what have we done for them? They are not asking for a free treatment. They are indirectly saying that I'm willing to pay, but create a vehicle for me to contribute. And this is what the young people should do. Create a vehicle for them to contribute. They will contribute. And we are 1.3 billion people. And amazing things can happen if 1.3 billion people start contributing. And then healthcare will become affordable to everyone. Cost reduction is not the way going forward. We have to look at the financial intermediary.
Thank you, Dr. Shetty. There is another couple of more, and I can't, these are all very good questions. Dr. Ramesh Tirnati is asking, how far do you think data analytics can help in India? And I'm reading the question as healthcare in India.
Data analytics will save millions of lives. Before that, I just want to tell you that 7 o'clock I need to leave, Suparna. Yeah.
Sure.
Yeah. The data analytics will save the life. I'll just give an example how we are using the data. If you look at a patient getting admitted to a hospital, staying in the ward after the heart surgery or a brain operation, you will notice that every 4 hours, nurses go around from one patient to the other. They go there, first check the pulse rate, then check the blood pressure, then shove the thermometer into the mouth, check the temperature, watch the respiration, right? Essentially, they do all those mundane work from morning till evening. Imagine if your job is doing all the things one after another for 8 hours during your shift. It is the most boring. We have made their life miserable by forcing them to do things what they don't enjoy. Now, this is not only in India, across the world, nurses has to do it and enter into the chart. Now, we are working with some company in Bangalore. You just need to put a patch, and that patch has a leads. It will give continuous ECG monitoring. It will also give the respiratory rate. It will give the temperature. It will give oxygen saturation. It will give you the blood pressure. And nurses will be sitting in the counter, and there is a big TV in front of them with a flag which can become green, orange, or red. This is called mu score. So the mu score is nothing but if the patient is stable, heart rate is fine, temperature is fine, blood pressure is fine, then the green flag will fly. The moment something goes wrong, orange or a red. So nurse's job is only to see the patients when the color of the flag changes to orange or red. Then they are doing the true nurse's job, taking care of the patient. So essentially, if you can replace the nurses and the doctors have two jobs. One is a mundane job of getting the data from the patient. Other one is interpreting it and taking action. Now, all these analytic tools will calculate the risk score, what we call as a mu score, and show that out of the 100 patients, you don't bother about the 95 patients. Don't waste your time. They are fine. Take care of those 5 patients who have a problem going on. Then the mortality in the hospital will go down. Nurses' satisfaction will increase. Then large number of girls will opt for this profession.
I know we have claimed too much of your time. I will request now Professor Aanchal Sharma to give a quick vote of thanks.
Thank you, Professor Basu. I'll be very brief and would like to begin this vote of thanks by quoting Dr. Shetty from the letter he wrote to the children after completing the first 4,000 heart surgeries on the children. And he said, I mean, this is from towards the concluding statements. He said, one day you will become an adult and probably a very important member of our society. You will have a lot of responsibilities and commitments. All I ask of you for is, can you spare a few moments of your precious time every day for someone who needs it? And that too, without expecting anything back in return. So, Dr. Shetty, thank you so much for your precious time today, for honoring us with your presence. And, this was truly a dialogue on social change, because you spoke of employment, women empowerment, you spoke of capability building of nurses, you spoke of entrepreneurship when you spoke of, Amaryllis, who joined hands with the hospital. So it was truly a dialogue on social change. We at FORE teach our students to be empathetic leaders, empathetic communicators. And I think your talk has really helped us conceptualize empathy from, a healthcare context. So thank you so much for being here today. I would also like to thank FORE School of Management, the director, Dr. Das. Also, thank you so much, the facilitators, the IT team, the academic office, the dean, Dr. Sangamitra, the faculty and students at FORE School of Management and the communication area. Thank you so much, Professor Sriparna, for inviting Dr. Shetty for the Global Leadership Lecture Series. Thank you so much. The other faculty members, Professor Rana and Professor Lal, for their support. Thank you so much.
Thank you, sir. Thank you so much. It was a privilege.
Thank you. Thanks.